Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Thank you for joining us today for a conversation with two state association executives on home-based care staffing and retention strategies. I'm Deborah Hoyt, Senior Vice President of Public Policy. As part of the Axxess team, I enjoy my strong relationships with the state associations and partnering on issues and advocacy to advance all matters related to healthcare at home. As home-based care has emerged as the premier setting for healthcare delivery, the individuals who provide that care are the most important asset to home care and home health and hospice organizations. Whether these caregivers are nurses, therapists, home care aides, or other types of support, each one plays a critical role in ensuring that the care provided is person-centered, of the highest quality, and provides the best outcome for that patient and their family members. As we enter into 2022 and the federal government's shift to a value-based reimbursement model for home health care delivery under Medicare, every employee and every caregiver within the agency must be aligned around the patient care, the clinical outcomes, and the quality measures so that their agency can succeed. To further explore this, I'm delighted to introduce our guest and our state association executives, Nancy Fitterer. Nancy's the president and CEO of the Home Care and Hospice Association of New Jersey, and Tim Rogers, president and CEO of the Association for Home Care and Hospice Care of North Carolina and South Carolina. It's so nice to spend time with you again, Nancy and Tim, after all these many months of COVID. Tim, considering the current workplace challenges, what are some success strategies that employers can use to retain their staff, reduce turnover, ensure worker happiness, and maintain patient outcomes?
What a year. What 2 years we've had. And what a loaded question, and what a very important question. I think what agencies have learned, what member agencies of our association have learned, what associations have learned, first and foremost, is communication is the key. Transparency and communication, checking in honestly and often, both professionally and personally, with staff has been something that has changed dramatically over the last year, especially. Checking in on the challenges of what the remote status workplace has looked like and what hybrid has caused it to bring into this work sphere. Listening has been the most critical aspect of all. We've always thought that employer and employee listening skills were important, but that's been ever more critical than ever before. And the mantra, money does not buy happiness. And now I think employers need to value an employee's flexibility, time, work-life balance. And they've put a lot of these aspects in place, not just bonuses and sign-on bonuses and recruitment, but they've done things in terms of hybrid workplace and looked at things that really make the employee a more flexible, happier employee. Because if that all leads to a better job and a better employee, it leads to better outcomes, a better patient care, and in essence, better employee and employee values. There's a lot of things specifically we can say, but I think a two-way communication between the agency's employer and employee has been more valued than ever before.
Thanks, Tim. That really incorporated so many of the key themes that we've been hearing all of the agencies talk about during COVID, and now a little bit post-COVID, how they need to really engage each worker, because each one of those clinicians is so critical to the outcomes now as we move to value-based, right? It's not just one clinician going into a home independently, performing their job and doing their role, but it really is team-based. So you've captured that very well. Thank you so much. Nancy, I wanted to open this up to you as well. What are your thoughts on this question?
Thank you, Deb. Thank you, Tim. I wholeheartedly agree with everything Tim said. You know, COVID caused such challenges, but what we think of the challenges may not be what the employee thinks of the challenges. Are folks talking and listening to their staff? are, doing focus groups. What we think may be important or what we think may be a large concern may not be as much of a concern. Don't assume what the concerns are. What motivates our folks to stay longer? What motivates them to work harder? I've talked to a lot of my agencies and my providers about this. This is, of course, the number one issue facing our industry, right? The staffing crisis, staff turnover, staff leaving healthcare altogether and going someplace else, right? Whether it be Amazon or any other place. And so, the providers that have done, I think, the best work are the ones that treat their employees more like a family, give them resources that wouldn't normally be typical for an employee to receive, whether it's mental health counseling, grief counseling. Pre-COVID, they were giving different workshops. They were inviting food banks and Medicaid and SNAP programs. They were doing all of these things that basically showed the employee that they cared about them. That, yes, you are an employee of ours. We're expecting you to do a job, but much more important than that, we believe in you. We believe in growing you as a employee and as a person. And we want to make sure that we're designing our workforce culture to really incorporate everything that they care about. That, I think is really, really important.
Thanks, Nancy. And building on that, so we all know value-based purchasing is coming to Medicare home health care in 2022, right? So just a short couple of weeks from now, it's going to look like a whole new world here for our providers and the environment that they're going to be delivering care in under this new payment model, which is going to reimburse more highly for high quality agencies that are performing well, and then obviously impact the agencies negatively in terms of their reimbursement over time if they're not performing well and their outcomes aren't as good. So, Nancy, do you think that this staffing crisis that you were just talking about has the potential to disrupt the delivery of favorable patient outcomes under the value-based purchasing plan as we move forward?
Unfortunately, I do. I think the staffing crisis will exacerbate issues that are already happening. And I think that as all of our agencies are moving towards, the value-based purchasing, and they are looking at ways to make sure that discharge planning is done accurately and effectively, and we're reducing readmissions and all of these metrics. The metrics only work if you have staff that is there, you have staff that is committed, and you have consistency. And so if you don't have the consistency and you don't have the staff, then it's going to be a lot harder to get the clinical outcomes that you want. Home care is where people want to be. I think you see Congress believes that now. I think you see our state legislatures believe that now. And in general, you are seeing a lot more money being given to home care, not as much as should be. But I think that if we don't fix the staffing shortage, then it will definitely have a negative impact. I don't see how it wouldn't. But again, there are ways to fix it, slowly but surely, working with state partners and federal partners. But, you have a set of outcomes that you are looking for. And if you don't have a motivated staff, or even staff in general that can take care of the patients, then of course it'll disrupt the delivery of services.
Thanks, Nancy. Tim, Nancy was mentioning partnerships. So I know that you're very engaged at the national level, the state level, and within the association and council network. So what are some of the ways that government and state and national associations and home-based care providers can do? How can they work together to improve the current situation around workforce and staffing?
You've hit the nail on the head, Deb. I mean, if anything, among the many things the pandemic has showed us is a value proposition back to the member agencies from state associations and the need to partner better, quicker, faster, more efficient than ever with our national partners. And I think that is shown itself time and time again in the last 2 years, especially in 2021. We've worked together on the national level with our national partners, those of us in the Council of State Associations, in the Forum of States with NOC and NHPCOs, Council of States, those that are part of HCOA and others, to look for better waivers, flexibility, workforce support, better rates, not just rates, but also, more importantly, any kind of waiver and flexibility in policy formulations that are just as important on the state level. And you have seen us hand in hand. I know I can speak to my 2 states, and we have hit the mat, ground running, in trying to get the federal government, CMS, and working with national associations to get as much waiver flexibility within Medicaid and Medicare as possible. And I co-chair the Palmetto GBA 16-state Home Health and Hospice Coalition. And any acronym that's been placed upon us in an audit situation with Medicare and the home health and hospice side, we've done it on that capacity, or have tried to do it in that capacity on the Medicare side. Look what we've done in telehealth. Look what we've done in the flexibility with telehealth. Look what we did on the state-by-state basis once we were given the green light federally with nurse practitioners and physician assistants and things like that. You also asked about other things that we can do working with federal regulators. We've been able to prove during the pandemic, or I think we have better than ever, we're frontline workers too. It's not just hospitals and nursing homes, but home care, home health, and hospice. And so therefore the respect needed to be given, and we needed to be just as much involved in all of that as possible. So I applaud everyone for stepping up, my colleagues in the state association world, and it's been a job well done in the partnerships that we've had.
Thank you, Tim. And thanks for your leadership. You've been a leader amongst the state association executives for so many years, and the things that you do with Palmetto and working with CMS is greatly appreciated, and it really has been able to permeate throughout the country in terms of the good work. So we really appreciate that. Nancy, I just want to give you the opportunity. Are there some things in New Jersey or on the East Coast, Northeast area that you've been working on that you'd like to add on to what Tim is saying?
100%. And I agree with Tim's leadership. So when we have a state association, the council, we all email each other whenever we have any questions or ideas. And Tim is always willing to share what he's doing in North Carolina and South Carolina, as are all the state execs. So we work really well and closely together. To me, having agencies work with their state association and their national associations are so important. I can't stress enough how important it is. And it's not just work with them when they're trying to get a rate increase, right? So we are trying to increase the rate for a certain, for a nurse or an aide, and they then reach out to their, to the legislature or the governor's office. It's really working with the state association and the national at all times. If the state Medicaid director knows who you are and has worked with you on a variety of issues, when you go and ask for rate increases, or you go and, lobby on a piece of legislation, they're more willing, I believe, to listen to you because they know your work, they know who you are. And so really being part of the conversation is so key. And, we've had members join that didn't really know what the association did. And, there's different types of members. There's members that want to join just so they can get information. There's members that want to be really, really involved. And there's kind of everything in between. But those folks that are really involved, I think they see how much the state associations do, but also they get access to different groups that they wouldn't normally get access to. We're working with the managed care plans and the Department of Human Services on the staffing crisis and on giving better certifications and more knowledge to our home health aides. I've got providers on there, myself, the managed care plans, the Department of Health, Department of Human Services. And what we're looking to do is we identify the problem. What are the different ways to fix it? How can we use providers to help them? How can we use the association, leverage everything the association does? And so really there are ways to fix it, but being involved to me is the most important.
I don't know if it fits congruently into this question, but it just dawned on me the creativity that both the state associations execs and the national association execs have had to be during all this in regards to your question, not only with government regulators and state and national governments, but in the crisis of the pandemic itself. put aside the waivers and everything else we had to work on. And I know other states did similar things like this, but in North Carolina, there was a state appropriation to hospitals and nursing homes for PPE. We were left out of that unintentionally. And so we didn't just lie there. We went out and sought a $250,000 grant for PPE from the State Employees Credit Union Foundation of North Carolina. And we bought PPE for our home care and hospice staff members, additional PPE. And then we're still doing that. And we became a distributor, a warehouse of PPE. So that's an example of trying to get government to see the frontline worker capability of what we need. And then when things don't happen the way they should, take the ball and run with it ourselves.
Thank you, Tim. Thanks, Nancy. You know, it is, right? Creativity is born out of situations like this. And it's really extraordinary the way that the associations and all of the providers have just, you know, been able to embrace this. We've gone virtual and people are just doing a really tremendous job to come together and work on this challenge together. So I applaud you both. Tim mentioned something earlier in one of his previous comments about technology and how telehealth is something that, you know, really came into itself during the pandemic because we needed to continue as an industry to go visit patients in their home. And at times it was impossible to see them in person, but telehealth really enabled that to move forward. So we're seeing in every industry, technology has been a disruptor, right? It's been able to transform situations into ones that are sometimes better than what we had previously. And we've kind of found that through telehealth. But I'm wondering if maybe we'll start with Nancy on this one. Are you aware of any technology innovations that are helping your member agencies around staffing, retention, or workforce development?
So I've had a lot of discussions about technology, the different platforms. I had a board meeting with my board just earlier this week. And one of the things that they were talking about is, you know, we need to really think strategically about utilizing technology to think like robust applicant tracking or technologies that will trigger if a patient is declining rapidly. We've got the technology to trigger it. So, you know, one of the things my board had asked me to do is look at and find different new emerging technologies that will help them with everything you just mentioned, with the workforce retention, with, you know, folks looking to start work in the industry or don't know how to start work in the industry. And then on the patient side, how are we monitoring patients to make sure that we are getting the best outcomes for them? So there's a lot of new technology out there. And I think home care has realized that to succeed now, you need to really not just shun technology and say, you know, this is kind of what we've always done, but to partner with technology companies and say, okay, you know, how are you going to help me with recruitment? How are you going to help me with retention? How are you going to help me look at patients? There is a lot out there. And I think it is incumbent on the state associations to help the providers and agencies know what they are. It's incumbent on our national associations to help us, and the technology, you know, our industry partners themselves. You know, we have a lot of different companies, of course, Axxess included, that work with the associations and work with providers. And, you know, there's a whole host of ways that they can help. And it's really, I look at my job as making sure that my providers and all the providers in New Jersey know that you're out there and other agents and other partners are out there that can help them.
Thank you. Tim, I know you've got things to add here too.
Yeah. No, Nancy's great at this. And it just made me think that colleagues like us and Nancy and wonderful business affiliates like Axxess, you've participated on when we couldn't meet in person. State associations on behalf of agencies did the best we could to bring vendors, business affiliates, and technology companies to them via Zoom and via roundtables, and did everything we could to introduce products and services, emerging products and services to member agencies. I know we were doing one that we liked before the pandemic, a company, not just to vouch for this one company, but Cantana and others, to do this name badge security situation of when employees go into a particular problematic neighborhood or a home. It's a self GPS security to let them know, whether they're in the home and if that's an endangered situation. And that's become very indoctrinated and supported among hospitals and healthcare systems, and now home care. So, that's another new emerging technology, and telehealth, of course, and the ever-changing EMR situation. And kudos to our colleagues, like Nancy and others, who did everything we could when we weren't meeting together in person to bring people together somehow, some way, so that agencies had access to a collective group of new technology.
Thanks, Tim. That's a great example of technology providing safety and enabling people to, the workforce to go into the home, for the worker to feel safe, and then for everybody in terms of the agency knowing where they are. So I really like that example as well. So I'm just thinking to kind of conclude our conversation, are there any other tips that we didn't talk about that you'd like to add in terms of recommendations for your member agencies, for the national associations or others that could really help solve and address this workforce challenge moving forward so we're more successful as an industry? So Tim, I'll start with you on this one.
If I had the answer, I would be $1 million seller in books, and I wouldn't be working here anymore. But I am chief cheerleader for my home care and hospice agencies in North Carolina, as is my dear friend in New Jersey, and you too, Deb, where you've been all your life. We have just got to keep an open mind and look to every single aspect, no stone unturned. We had a workforce development problem prior to COVID. And we're going to have a workforce issue going through COVID that's exacerbated it. So therefore, we have to be more creative. We have to put pressure on our legislators and members of Congress to make sure they understand that workforce issues are not just nurses in healthcare systems, but they're nurses in the home, and they're nurses in hospitals, and they're physical therapists, and they're in-home aides. And I know one example I'll give you, and I know some of my colleagues have done similar things, but our Hospice and Home Care Foundation in North Carolina, just before COVID, got a $500,000 grant to do an onboarding and issue situation to address the shortage of nurses in home health and hospice, to do a clinical rotation and onboarding situation and model. We chose 7 pilots and 7 schools of nursing in North Carolina. And we're in the 3rd year of that. We developed a tool for these nurses to where they could come right out of school and go directly into home health and hospice, dispelling the myth that hospitals and health care systems are the first choice of employment out of nursing school. And we are seeing success stories of nurses going directly into home care and hospice using that onboarding model. It's not the perfect tool, but we are learning a lot from that. We want to get a second round of funding, and other state associations and nationals are doing that. We've had Bill Dombey help us at NOC with this situation. That's just one drop in the bucket of what we're trying to do. We've got to convince schools of nursing and other schools, professional clinicians, that this is an issue. And the final thing I want to mention on this is the biggest area of concern to me in workforce is the rurality in rural America. And that is where it's really going to come to roost. Thanks.
Thank you, Tim. I do everything that you just said around the education, the clinical opportunity for them to learn this, right in the nursing schools, so that they will be ready, willing, and able to go out and work directly in the home-based care field. I think it's the future. We just have to make sure that we can partner with the deans and directors at the various schools. And there's national and state workforce centers that have money for this, just exactly like you said, some of these new programs. And I really commend you for jumping on board with that, because I think that's going to be our future. So Nancy, I know you're probably doing other things and have thoughts there as well.
Absolutely. Well, to Tim's point, we actually had a nursing summit beginning of November. And one of the things we talked about is, the mantra is you have to go to a hospital first, right? And, nursing schools don't teach about home care. And, the coalition that was on the call, it was our colleges, it was the Board of Nursing, it was a variety of people. And that was one of the things we talked about, to get a pipeline directly from nursing schools to home care. And also we're working on a program that we're allowing high school students, we're doing VOTEC. So a high school student will actually get all of the certifications to be a home health aide. And so when they turn 18 and they can become a home health aide, they've already passed all the courses and they can start working directly. I really think that innovation is key, thinking outside of the box. I know COVID has stretched our limits. I know all of the different waivers that we are under, all of the different regulations, whether it be on the state or federal level, have people at their wits' end. But, not only is home care where people want to be, but we need to be innovative in what we think and where we think we can bring home care. And whether that's new and emerging technology, whether that, like I said, is being part of a group, an association that says, this is what I believe home care should look like. When similar to what Tim said about not getting PPE, New Jersey intentionally did not give home care PPE because they didn't have enough. And so we had said, well, that's not acceptable. We got a grant, we gave out PPE, but we had made such a fuss about not being included that when the vaccine rollout came out, home care was the first simultaneously with hospitals to get the vaccine. We created clinics in home care agencies that people can go, any healthcare worker, of course, including home care, could go and get a vaccine. And that was December and January of last year and this year. So, being a voice, whether from the association or as a provider, being a voice and saying home care matters, this is the way to make home care better, and really hammering that into, the minds of the governor, the legislature, Congress, I think is key. And I think with President Biden, you have somebody who does seem to understand home care, does want to fund it more. So I think we have an amazing opportunity.
Well, that was so well said. I would just leave it at that. You've done a great job, both of you. Thank you so much for joining us today. And Tim Rogers, Nancy Fitterer, we couldn't have had better guests on this topic. And I hope that our listeners today gained a lot of insight from you and some thoughtful opportunities so that they could bring those into their own agencies to make it a better situation for their staff too.
Could Nancy and I leave one departing thought? Not only besides thanking you and the viewers, but to really help to be an engaged partner. Nancy and I talked about this. Be an active member of your state association and be an active partner in your nationals with us. We can all work together to make this a better home health and hospice environment if you have active, engaged members in the state association. That way we can introduce you to business partners like Axxess and get you involved collaboratively with our national partners. I think my friend Nancy would agree with that.
100%.
Yeah.
Well, that's great. That's terrific. Thank you so much. So thank you, Tim Rogers. Thank you, Nancy Fitterer. Thank you to the people watching today. I hope that they've gained some great information that they can take with them and use. And on behalf of Axxess, we appreciate you joining our ongoing series of educational programs. Have a wonderful day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.